Welcome back to the deep dive. If you're navigating the world of IVF, you definitely know it's a lot. High stakes, high stress.
It really is.
You're juggling appointments, medications, hormone levels, all that clinical stuff. And, somewhere in the middle, you're probably looking for something, anything supportive to help you feel a bit more human again.
Absolutely. Finding ways to cope is key.
So today, we're trying to cut through some of the noise around complementary therapies. We're taking a deep dive into two really popular ones, yoga and massage.
Yeah, they come up a lot.
And the big question isn't just, do they feel good? We kind of know they do. It's more like, can they offer a real advantage alongside the medical treatment? And maybe how do they compare to something established, like acupuncture?
Right, and that's really the mission today. What we found digging into this is that the advantage isn't necessarily about one beating the other. It's much more about timing and safety.
Safety, okay.
Yeah, it's all about how you integrate these practices, like safely and mindfully, into what's already a super complex medical schedule. Because honestly, ignoring the phase of your cycle, that can actually turn something that feels good into, well, a genuine risk.
Wow. Okay, so let's get into that. Where do we start?
Let's start with the big universal benefit they both share, which is basically fighting that physiological stress response.
The stress. Always the stress with IVF.
Always. IVF is just inherently a massive stress trigger.
Yeah.
And all that anxiety, that flood of it, makes your body pump out stress hormones, mainly cortisol.
Okay, cortisol. We hear about that a lot. Bad news generally, but why is it specifically a problem during fertility treatment?
Well, it basically creates hormonal chaos, or turbulence maybe. High cortisol levels can actually interfere pretty directly with your key reproductive hormones.
Like FSH and LH.
Exactly. Follicle-stimulating hormone, luteinizing hormone, the ones driving the whole process. So optimizing your hormonal environment isn't just about the drugs your doctor gives you. It's also about dampening down that internal stress signal.
So your body can actually respond better to the treatment?
Precisely. You want the treatment to have the best possible chance to work.
Okay, so let's look at the mechanics then. If I say, go get a massage, how does that physical touch actually change my body chemistry? Is it just feeling calm, or is something measurable happening?
Oh, it's absolutely measurable chemistry. A good, gentle massage actively helps lower that circulating cortisol.
Right.
But it's a double whammy because it also stimulates the release of positive hormones. We're talking endorphins, your body's natural painkillers, and oxytocin. That's often called the love hormone or bonding hormone. It brings that deep sense of calm and connection.
Okay, interesting. And yoga, it tackles stress differently, right? It's not just passive touch.
Yeah, yoga's approach is more active internally. It uses that combination of postures, mindfulness, and very specific controlled breathing techniques. That's called pranayama.
Pranayama, okay.
And that trio postures, breath, mindfulness, it's designed to essentially flip your body's internal switch.
Yeah.
To activate the parasympathetic nervous system.
The rest and digest system, not fight or flight.
Exactly. It shifts you out of that constant state of high alert that stress creates into a state of calm and recovery.
So bringing that together, managing stress, effectively helps everyone involved, doesn't it? It's not just the person undergoing the main treatment.
Absolutely. You hit the nail on the head. IVF is taxing for the whole couple, the whole support system sometimes. So lowering cortisol through practices like these, it supports overall emotional resilience, hormonal balance, well-being for both partners going through it together.
Okay, that makes a lot of sense. So let's move beyond just general stress relief. What about yoga specifically? What unique benefits might it offer someone, going through IVF? We need the details.
Right. So what the research suggests is that beyond just calming the nervous system, yoga seems to offer, three key potential benefits. One is improving blood circulation and, importantly, circulation to the reproductive organs. Two is helping support hormonal balance, maybe through gentle stimulation of endocrine glands.
And the third?
Well, the third is really tied into the stress reduction we already talked about, but it's profound.
Yeah.
And this is huge, but it all comes down to the intensity and the type of yoga.
Ah, okay. So not just any yoga class will do.
Definitely not. You need to be extremely mindful here. The styles that get the green light are generally slow, passive, and restorative. Think restorative yoga. That's the one that uses a ton of props. Blankets, bolsters, blocks to support you in passive poses for longer holds. Very gentle.
Okay, what else?
Yin yoga, which targets connective tissues with longer holds, can be good. Again, gentleness is key. Or a really gentle hatha yoga class, the slow-paced kind.
So what should people absolutely avoid?
High-intensity stuff. Anything vigorous like power yoga or vinyasa flow, especially fast flows, and definitely hot yoga. Raising your core body temperature is generally not recommended during fertility treatments.
Right, that makes sense. So if the usual suspects like downward dog might be out or need modification, what specific poses are generally considered safe and supportive?
Good question. The best ones focus on relaxation and gentle pelvic flow without any strain. A classic is legs up the wall pose.
Oh yeah, Viparita Karani.
That's the one. Great for pelvic circulation, very relaxing. Child's pose, or balasana, is like the ultimate stress relief pose, just folding inward.
Simple but effective.
Totally. And gentle hip openers like butterfly pose, Baddha Konasana, sitting with the soles of your feet together. That can gently encourage blood flow to the lower body without pressure.
This really highlights the timing aspect you mentioned earlier. It sounds critical, especially during the stimulation phase, when the ovaries are enlarged from all the follicle-stimulating meds. What's the hard stop guidance there?
Yeah, this is non-negotiable safety advice from the sources.
Yeah.
During stimulation, you absolutely must avoid deep twists.
Okay.
Also, full inversions, headstands, shoulder stands, even potentially prolonged or deep downward dog for some, and any strong compression on the abdomen.
Why exactly? What's the risk?
The big risk here is ovarian torsion. That's where an enlarged ovary can actually twist on its supporting ligaments, cutting off blood supply. It's a serious medical emergency.
Right. Definitely something to avoid.
Absolutely. And it's not just during stimulation. You also really need to listen to your body and plan for maybe 1 or 2 days of complete rest right after the egg retrieval procedure. Let your body recover fully.
Okay, that's clear. Yoga needs careful timing and style selection. Now let's switch gears to massage. There's the element of, caring human touch, which can feel so needed during such a clinical process. But it also sounds like it brings its own set of risks.
It definitely does. And that's where the focus has to shift, again, really sharply towards safety and awareness. Don't get me wrong, a gentle, like Swedish-style massage focusing on the back, shoulders, limbs, that can be wonderful for releasing tension. We hold so much stress in our neck and shoulders, right?
Tell me about it.
But even with that, we have to be acutely aware of what the body is doing internally during the IVF cycle.
Are there any specific massage techniques that might be helpful for IVF side effects?
Well, some sources mention lymphatic drainage massage.
Yeah.
It's a very light technique that might potentially help with common issues like bloating or fluid retention that can happen during the stimulation phase.
Okay, but gently.
Very gently.
Yeah.
And again, with a qualified therapist.
But
The intensity warnings, they have to be absolutely front and center.
so let's get really specific. What are the absolute no-goes, the contraindications for massage during IVF?
Okay, rule number 1, avoid deep tissue massage, no matter how tempting it is for sore muscles.
Right. Too much pressure.
Exactly. Also, anything that significantly raises core body temperature. So hot stone massage is out.
Okay.
And critically, any vigorous or deep massage directly on the abdomen. Just avoid it.
And the timing. Are there specific points in the cycle where abdominal massage is particularly risky?
Yes, absolutely. No deep abdominal work during ovarian stimulation because of those enlarged sensitive ovaries. And perhaps most importantly, absolutely no deep abdominal pressure after the embryo transfer.
Because of implantation concerns.
Precisely. The idea is to create the calmest, most receptive environment possible. You want to treat that whole pelvic area with maximum respect and minimum physical disturbance while implantation is hopefully occurring.
This really underscores the need for the right practitioner, doesn't it? This isn't just popping into any spa for a back rub.
Not at all. You absolutely need to find a massage therapist who is specialized in fertility or prenatal or IVF massage, someone who truly understands the cycle.
They need to know the contraindications for each phase.
Exactly. They need to know your specific cycle phase and what's safe when. And it's not just techniques, it's also about products.
Products, like oils.
Yeah. The sources warn about certain essential oils that might have hormonal effects, things like clary sage, which is sometimes used for menstrual issues but might interfere here. Even high concentrations of things like lavender could potentially contain phytoestrogens.
Wow, I wouldn't have thought of that.
It's subtle, but you want to be cautious. So the therapist needs to be knowledgeable about safe products, or ideally, you clear everything with your fertility specialist first.
Okay. And what if someone gets a massage, even a supposedly safe one, and feels worse afterwards? Are there warning signs?
Yes, Absolutely immediate stop signs. If you experience any severe abdominal pain or if bloating gets significantly worse, which could potentially be a sign of OHSS, ovarian hyperstimulation syndrome,
Which is serious.
very serious, or if you feel dizzy or have any spotting or bleeding, any of those, stop the massage immediately and call your doctor or clinic.
It really sounds like integrating these supportive therapies takes almost as much careful planning as the medical side of things.
It does. It requires awareness and communication with both your therapist and your medical team. It's an extra layer to track, but it's crucial for safety and ultimately for getting the benefits without the risks.
Okay, so let's circle back to our original question then. We asked if massage or yoga could potentially beat acupuncture in terms of boosting IVF success rates. What did the deep dive reveal about that comparison?
Well, what we really learned is that the available scientific evidence doesn't strongly support the idea that one definitively beats the others in terms of, like, dramatically changing live birth rates directly.
So it's not a competition.
Exactly. Instead, the real power seems to lie in thinking of yoga, massage, and acupuncture as all being part of a toolkit. They're all essentially sophisticated stress management tools.
Yeah.
They work in different ways: touch, movement, energy points. But the common thread is helping you manage the immense stress of IVF. And by doing that, they can indirectly support your overall well-being, maybe hormonal balance and emotional resilience during a really tough process.
Which could potentially influence outcomes, but it's hard to measure definitively.
So it's more like they form an integrated support team for your body and mind.
That's a great way to put it, a support team.
If someone wants to use multiple approaches, say do yoga and also get acupuncture or massage, is that okay? Are there any rules for combining them?
Yeah, that's perfectly fine, but spacing is generally recommended. If you are going to combine them, like maybe doing a restorative yoga class in the morning and then having an acupuncture session later, it's a good idea to allow at least, say, 2 to 3 hours between those different types of sessions.
Why the gap?
It just gives your nervous system a bit of time to kind of process and integrate the effects of one modality before introducing another stimulus. You don't want to overwhelm your system, even with relaxing things. Right, it makes sense. And thinking holistically, we shouldn't forget the partner's role in all this, should we? These practices don't have to be solo activities.
No, absolutely not. That's such an important point. Think about partner massage, for example. Even just simple, gentle touch between partners can dramatically boost that bonding hormone, oxytocin.
Which helps with connection during a stressful time.
Exactly. It reinforces that feeling of being in it together. And partner yoga can be wonderful too. It provides a shared activity, a shared space of calm, and helps couples navigate the emotional ups and downs as a team, reducing stress for both.
That's lovely. So kind of bringing this all together, what's the final takeaway message here?
I think bringing back to our mission, the ultimate goal of using practices like yoga or massage alongside IVF isn't really about finding a magic bullet to replace medical treatment. It's about empowerment.
Empowerment? How so?
They empower you to actively participate in your own well-being, to maintain emotional and physical resilience throughout this incredibly demanding journey by consciously managing those problematic stress hormones like cortisol and fostering a sense of calm.
Empowerment through active self-care. I like that. It gives you back some control in a process that often feels very out of control.
Precisely.
So since these therapies are so focused on things like improving circulation and taming stress, here's a final, maybe provocative thought for you listening. Why not try actively tracking the benefits?
Oh, interesting. Like a journal.
Yeah, maybe document the physical changes you notice: less tension, better sleep. Note your mood fluctuations, track your sleep quality. Keep this little log right alongside your medical data, your hormone level results, your ultrasound findings.
Ah, I see. So you can actually see for yourself how these complementary practices might be supporting your overall well-being and maybe even correlating with your cycle's response.
Exactly. It makes the connection more tangible. Food for thought, anyway.
Definitely something to consider.
Now, before we wrap up, we absolutely must remind you that our entire discussion today has been purely for educational and informational purposes.
Yes, very important.
It should never, ever be considered professional medical advice. Please, always, always consult your own healthcare provider or your fertility specialist before starting any new complementary therapy or making any adjustments whatsoever to your prescribed medical treatment plan.
Your doctor knows your specific situation best. Always talk to them first.
And if you are looking for more comprehensive information about the entire IVF process itself, you can find resources on the portal ivfforme.com.
That's ivfforme.com.
Thanks for joining us for this deep dive.